Sign and symptom of hepatocellular carcinoma. Liver carcinoma is divided into two groups: primary hepatic carcinoma and secondary or the metastatic carcinoma. Primary carcinoma arises or originate within the mass of the liver from the hepatocytes. There is mutation of the normal DNA of the hepatocyte into the abnormal form, that is the cancerous DNA. And that DNA order or command the factory within the cells to produce the protein which is necessary for the replication of the cancer cells. So this is the pathogenesis, that the factors which irritate liver parenchyma constantly for prolonged period produces irritation, acute chronic inflammatory process in the liver, which leads into the fibrosis, that is called as cirrhosis, and ultimately that ends in the liver cancer. Whereas the metastatic carcinoma of the liver, that the cells of the cancerous cells from the various other parts of the body suffering from the carcinogenic changes, that is from the prostate carcinoma, breast carcinoma, bone carcinoma, lungs carcinoma, then intestinal or gastric carcinoma, brain carcinoma. So from other parts of the, the organs which are suffering from carcinoma, that metastatic tissues that are broken down, and through the bloodstream or the lymphatic channels that lodges or reside in the liver parenchyma, and there they produces the cancer. This cancer is called metastatic, and it is, for example, term, if it is from, in females it is from breast carcinoma, so it is termed as metastatic breast carcinoma. If it is from prostate in the males, then it is termed as metastatic prostatic carcinoma. So this is not the original carcinoma, but it is a metastatic that is coming from the other side of the body suffering from carcinogenic process. Now the symptoms. So symptoms can be divided: symptom originating from the suffering of the parenchyma of the liver, that is the primary carcinoma, which is originating from the hepatocyte within the liver cells. The symptoms produced due to this primary hepatic carcinoma, while the symptoms produced by the metastatic process, that is the liver cells, they break down and then passes from the blood channels, bloodstream, and the lymphatics to the other parts of the body. So where they are producing the metastatic carcinoma, the symptoms that produce, they are according to the organs involved or suffering from cancerous changes. Mainly there is fever, nausea, vomiting, loss of appetite, early satiety, weight loss, jaundice, pruritus, myalgia or arthralgia. Then there are seizures, shortness of the breath, ascites, malaise, fatigue, depression, and the various stress and psychological complication or the symptoms are produced. So these are the various symptoms which are produced by the hepatocellular carcinoma in the body. Now next is the diagnosis of from the symptoms or the history of the patient, physical examination, that is on palpation, there is tenderness and pain in the right hypochondrium, there is a mass or the lump in the right hypochondrium, then there is peritoneal fluid that is called as ascites. So these produces there is shifting dullness, fluid thrill. These are the tests physical examination can be performed. In addition to this, the most time honored device is abdominal ultrasonography. In this, sound waves of various velocities are produced to produce the images in the body. By ultrasonography, we can detect the size, situation, and the number of the tumor nodules in the liver. More detailed study can be obtained by the CT scan, MRI. So by these two devices, we can study the detailed structure, variety, situation, extension, and the grading of the hepatocarcinoma. Next, which is rarely performed, is the biopsy. We get directly from the small quantity of the tissue excised from the tumor, sent into the laboratory for cytological study under the microscope to study the type of the carcinoma in liver.